afternoon, Namibia, and welcome to yet another session at the Government Information Center. My name is Joanna Otoni, and I will be your host for this afternoon's session. Today's the 4th of July. We are discussing the revised COVID-19 isolation and quarantine measures as informed by the scientific evidence provided by the Ministry of Health and Social Services, together with their strategic partners, that is the Ministry of Health and Social Services, together with their strategic partners, that is the World Health Organization and Center for Disease Control and Prevention. Basically, isolation and quarantine were some of the primary healthcare safety measures that the Ministry of Health and Social Services has actually employed to curb the spread of the virus and subsequently contribute to us reaching herd immunity. Today in studio, I am joined by two experts from the fraternity that are going to help us dissect this very topic. From my far left, I am joined by Ms. Amy Elsie De Vaitela. She is a surveillance lead from the Ministry of Health and Social Services. Good afternoon, ma'am.
Good afternoon, Joanna.
I'm also joined by Dr. Catherine Muwonge. She is an epidemiologist and case management focal person from the World Health Organization. Good afternoon, doctor.
Good afternoon to you, and good afternoon, viewers. Thank you for having me.
Usually, at the beginning of our show, we usually have an official from the Ministry of Health and Social Services to issue the COVID-19 vaccination update. However, in absence of them, we are going to kick right straight into our discussion. Dr. Catherine, I would want to start with you.
Yeah.
When we talk about isolation and quarantine, these are two different terminologies. Could you please explain the difference between isolation and quarantine, and also in the same vein, explain when each is required and or applicable?
Thank you very much for your question, and thank you for having me on this show. Good afternoon to the viewers. Yes, isolation and quarantine are two terms that have been sometimes used interchangeably and to mean the same thing, and yet they are actually different terms. Both terms, both isolation and quarantine, are public health measures that are used for, in public health situations to prevent the spread of infectious diseases, sometimes also referred to as contagious diseases, among the population. Isolation, to begin with, is a measure that is used to separate those who are sick, and in epidemiological terms, we refer to the sick as cases. We separate the cases from those who are not infected by whatever causative agent it is, and for this, in this case, we are discussing about COVID. So it is a measure that separates those infected with the virus that causes COVID to prevent them from transmitting the disease to those who are not infected. And for quarantine, we separate, quarantine is a term that means also that we separate those who may have the disease as a result of having been in contact with the cases or those who are sick. And the goal is to keep them away, separate them, and restrict movement so that we see whether they will develop the disease. Our goal is not just to see whether they will develop the disease, but we know that when one is exposed to a case, they may eventually go ahead to develop the disease. And before they do so, we know that before 2 days, 1 to 2 days before they actually develop symptoms, if they are to get infected, they can transmit the virus to those who, to the public. And therefore, we tend to separate them from the general public so that in case they are infected with the virus, they do not spread it to those who are not infected. Therefore, these two measures are different. Isolation, meaning that we isolate the sick, whereas quarantine is separating those who may develop the disease because they've been in contact with the cases or the sick to prevent transmission of disease.
Thank you, Doctor, for that elaborative answer. So in a nutshell, isolation is when you are kept away because you are sick, whereas for quarantine, you are kept away because you've been exposed to danger to observe whether you develop the illness, and you can be released thereafter should you not form any symptoms and whatnot. All right. Yes. So staying with you, Dr. Catherine, as per the World Health Organization guidance, please enlighten the public on how isolation and quarantine are regarded as effective measures on the prevention and reduction of COVID-19 transmission in the community.
Okay, thank you. As I have mentioned earlier, these two measures are public health measures that with the intention to stop the transmission of disease within a community. However, they are not used in isolation. In other words, there are other measures that must be put in place or should be coupled with isolation and quarantine. For instance, for us to be able to isolate those who we refer to as cases or those who are sick, we must identify them. We must identify the cases, and we do this through screening. Through screening, we mean that we test them and identify them as either being positive with the disease, and therefore they are classified as cases, or if they're negative, we know that they do not have the disease. So isolation begins with case detection through screening. And once we do that, we also investigate the case. And what we mean by investigating the case or investigating the individual who is sick, we try to establish epidemiological, issues around the case. And some of the things that we test for or we investigate for are those who this case has been in contact with, and those who may be exposed to the virus. And we call this contact tracing. So contact tracing, from the contact tracing, we are able to identify the contacts who then we shall be able to put into quarantine because they do not have symptoms. We are not sure whether they have been infected or not. So we restrict their movement or restrict their mobility by keeping them in quarantine to observe whether they will get the symptoms. And in case they do not get the symptoms, we also test them at the end of the quarantine period to establish whether they have actually become cases. And in so doing, we are limiting the spread of the virus. We are limiting the spread of disease.
All right. Taking from your response, I observed 3 steps, which is contact tracing, quarantine, and then testing at the end. Now, bringing back to the Namibian context, do you think these measures of isolation and quarantine had been effective in Namibia? And if you believe so, to what extent?
Okay. These public health measures, their effectiveness depends on what stage of transmission we are in or we are at. As you may know, that the pandemic started 2 years ago, and it was an imported disease into Namibia. So initially we had very few cases in Namibia, during that time, these measures, that is isolation and quarantine, were easy to enforce because we had very few cases. And in so doing, because they were enforced, we were able to contain transmission of disease. And these measures were also coupled with other measures, which included lockdown, strict lockdown, and also at the time, because we had very few cases, the Ministry of Health was able to have designated facilities for isolation, such that when a case was detected, they were sent to that facility if they had mild disease, or were hospitalized if they were severely or critically ill. And so the contacts, they were able to designate facilities for quarantine services. And so these measures were very effective in the initial stages of the pandemic. And as you may have realized, during the onset of the pandemic in Namibia, we tended to have what they referred to as a flat epicurve, okay? We did not have cases, transmission. Transmission was contained with the few cases that we had. But as you know, that these measures, the strict lockdown and designated isolation and quarantine facilities, was not sustainable. We could not sustain these measures. So some of these measures were relaxed, especially the strict lockdown. And therefore, people were free to move. And so when we got to the third wave, when we had a really highly contagious strain of the COVID virus, the Delta variant, and which was really virulent as well, virulent meaning that it caused severe disease. The number of cases that arose as a result of that variant were exponential. There were so many cases that came up at a time. And therefore, the strict measures of isolation and quarantine were difficult to implement. Mm-hmm. And therefore, this resulted in an exponential number of cases arising and community transmission. And at that point, when there was widespread community transmission, it was difficult to maintain or enforce these measures. However, having said that, we still need to maintain these measures, even though we are now at a different stage of the pandemic where we have community transmission. But even as we speak of community transmission, we have seen that there are still pockets of populations where there is more transmission, for instance, in schools. And therefore, if the schools, as the students in the schools are isolated and quarantined to prevent transmission into the population, into the general population or the communities where they come from, mm-hmm. It's still it's still effective. And as we enforce or we focus on increasing our vaccination campaigns and increase the uptake and coverage, it is still important to continue observing these measures so that the vulnerable population can be protected, and also our health system can also be protected if the number of cases that arise is not exponential or a lot.
All right. Thank you, Doctor. Ms. Ndavaitala, we have not forgotten about you. Your ministry has recently revised the guidelines on COVID-19 isolation and quarantine. What informed this decision of the revision?
Thank you, Joanna, for that question. Of course, as you have introduced rightfully that the guidance or the preparedness and response to this pandemic, we had been following with keen interest the new development which is coming into the scientific world. So this is the literature which we review and we understand what is happening globally, which is informing also the measures which we apply in the country. But not only looking at that, we have also to consider the context. That's why we look at our data. How is our epidemiological situation look like? So all that put in context and looking at the global guidance by the mainly health bodies which is guiding the health internationally, that is the World Health Organization. They issue guidance globally which could be adapted to countries, and also U.S. Center for Disease Prevention and Control, we shorten CDC. Those are the guidelines we mainly look at, and we determine, considering the situation at home, is this something which we could apply, but we need then to adopt? Because those guidelines, they are not meant to be just like copy and paste, because each country, each context differ. So you need to adopt based on your context. So those are the issues which have informed our change.
All right. Namibia, this is a public conversation, and would want to invite you, our viewers and listeners out there, to actually form part of this very conversation by 1:30. The number to call in studio, it will be 061 400 397. The area code is 061 400 397. And in an event, you are following us live on our social media platforms, which is Facebook and YouTube. Our handle on Facebook is Ministry of Information and Communication Technology - Republic of Namibia, whilst on YouTube is MICT Namibia. By 1:30, we'll definitely be looking forward to your comments, questions, concerns, and also contribution to the discussion. Moving on with the discussion, Ms. Nevaitela, given that some of the measures and guidelines have been reviewed, could you please highlight these notable changes?
Okay, thank you very much. We are discussing these two concepts, the measures which we normally, or the interventions which we apply, starting with quarantine. The new development is that we change the duration. This we had been changing I think since 2020, based on new development, as I have indicated. Of course, we started with quarantine for 21 days, because that is the whole period of incubation period. Then we moved down to 14 days. Then we slashed it again to half period to 7 days. So the latest guidance is that we have shortened again this period, that whenever you are advised to quarantine, you are quarantining for a minimum of 5 days. So, and we are saying it's on day 5 when you get tested. So when you receive your result, that is when, if it's negative, then you are released from quarantine. If it's positive, that means you are infected, then the case management team would then also probably review, looking at the period you had been quarantining, because with isolation also, we have shortened. The isolation, again, we started isolating. You might recall from the beginning, when we started with this pandemic response, our de-isolation was informed by the negative test. 2 subsequent negative tests, 48 hours apart. That is where we started. New developments came up that then we learned that a person continue testing positive, even that person is no longer infectious. Then we changed that. Then the last intervention or the period for isolation, we were isolating up to 10 days. That's where we had been. But with this new scientific evidence, is pointing to that if a person even is infected by testing, that you test positive for COVID, or SARS-CoV-2, that's the virus which caused COVID-19. If you do not have symptoms, or your symptoms are mild, just like normal flu, then you can only now isolate for 5 days. Then you can go back. But we put a caution that, of course, it's not one size fits all. You might not know who are those few percentage which might be outliers, which might be likely to transmit beyond that time. That's why we still caution the public that even after 5 days that you are no longer in isolation, we still encourage that you remain putting on consistently your well-fitting face mask, covering your nose and the mouth, so that we don't really necessarily pass the infection. And as we know, this situation had really been protracted and it's with us for a longer time. We need also to learn to live with it. We know at the time when we really tried to strictly apply these measures, it affected negatively the livelihood and also the economy. So we have to strike the balance. As much as you are protecting the public health, how are those people surviving you are protecting? How is the economy? That's why all these factors are put into consideration, and you put the balance. How should we manage that we still maintain protection of the public health, but also not killing the economy and not bringing adverse, putting the population or the community in the adverse situation. So those are the issues we have looked. The incubation period have not changed. What we have learned is more of what is the time when the person is more infectious. That is mainly the first days when the person develops symptoms. That is the period mainly when the person can pass the infection from one person to the other. That's why the need for us to reduce on this number.
Thank you, Ms. Devatela. Staying with you again, you have highlighted on the changes. Could you kindly then highlight on what has not changed?
Okay, thank you. Maybe before I shift to what have not changed, just also to highlight that when it's come to quarantine, we still emphasize, and this is why we have started also in our guidance for last year, that if a person is fully vaccinated, then this person might not need to quarantine, provided that they do not have symptoms. But even if you are fully vaccinated, but you are having symptoms, then you would quarantine at least till day 5 when you are cleared that those symptoms are not related, are not COVID. And also, probably something which we bring in now is those who have recovered, because if you have got COVID before, so the scientific evidence is pointing to the fact that this virus gives you that natural immunity after you get infected, meaning that you remain sort of protected for a period of about 3 months. That's why we are also exempting for those who have recently recovered within 3 months, that they don't need again to be quarantined when they are exposed, because they are less likely to develop the disease, almost just like the vaccinated. What remain not changed is that, of course, we are still encouraging people to use their face mask during quarantine, and also immediately after quarantine. And we still encouraging people to get tested, because as we say now for quarantine, we shorten up to day 5. We still need to determine, now that you had been quarantined, is it COVID? Did you develop the infection after that exposure? It's a contact that you are advised to quarantine. That's why we need to test at day 5. The only change there is the date. So we had been testing at day 7, but now we are testing at day 5. So we still test.
All right. As I said, this is a public conversation and would like to hear from you, our viewers and listeners out there. Maybe you have questions, comments, or contribution to the discussion. The number to call in studio is 061 400 397. You can also post your questions on our social media platforms, so we are streaming this show live. On Facebook, our handle there is Ministry of Information and Communication Technology - Republic of Namibia. Whilst on YouTube, we are at MICT Namibia. Or maybe you might not have comments, you just want to contribute in terms of maybe you have an uplifting story that you or your family members had actually benefited from you being isolated or quarantined. Would love to hear from you. Moving on with the discussion, while we wait for our callers and viewers to contribute to the discussion, Dr. Catherine, Ms. Nevatela spoke about testing after 5 days. Why is it necessary? After you are being quarantined.
Okay, thank you very much for your question. As I mentioned earlier, our goal for quarantine is to see whether someone will get the disease if they've been exposed, and for us to say somebody has got the disease is if they develop symptoms. But they may be asymptomatic and not develop symptoms, and yet they were infected. So we still have to go ahead and do the test to confirm whether they were infected or not. And adding on to what Ms. Ndivaitela has spoken about, the group that may not need to be quarantined. That is for those who are fully vaccinated or those who have just had come out of an infection in the last 3 months. This group of individuals, according to our guidelines, do not need to go into quarantine. And this is guided by scientific evidence that because of their body's immune response from previous infection and from the vaccine-initiated immune response, the virus, if they were to be infected by the virus, does not, their body immune system does not allow the virus to replicate. And therefore, even if it were to replicate, it would not have the potency to be transmitted to someone else. And therefore, that's the reason why they should not go to quarantine, because the risk of them transmitting the disease or the virus is very limited, because they have their viral replication is not there, or if at all it is, the virus is not potent and may not be transmitted. However, it is still important to have these individuals tested. As you may know, we are still in the pandemic, and therefore every piece of data that we generate and collect is very important. And so testing these individuals will help us to still determine the burden of disease and the epidemiological trends of the disease, and therefore the need to continue testing these individuals.
Perfect. That is well put and well explained. So even if you are being quarantined, you still need to get tested. Ms. Ndivaitela, as per the current practice, all confirmed asymptomatic or mild COVID-19 cases can be managed at home if home facilities allow for proper isolation. I would want to find out, in an event, I'm at a house where I can't do self-isolation, does the government still provide self-isolation facilities for individuals?
Thank you for that, and I would really like to clarify this issue. As Dr. Catherine have indicated that at the beginning when we started responding to this pandemic, as the ministry we have repurposed number of facilities, being hotels, guest house, or any other places which we had been using. Of course, at the beginning we were at the stage where we were really trying to eliminate or to limit the transmission at the source. When you find the person infected here, you try by all means that person not to duplicate again, or that virus to replicate, to move to other people. But when it came to the time when the situation went sort of out of hand, then we were at the wide community transmission range, then what we do mainly is to control. Because of course reality has taught us that you cannot avoid all the infections, but you need to control, mainly also targeting the vulnerable community members. Mainly there were people with comorbidities, people with low or immunocompromised situation. So at this stage, we are really applying home quarantine and home isolation. We do not use other facilities for isolation or for quarantine. For one, it's not sustainable. It had been a costly exercise, but as scientific evolved, as we are saying, our response is really informed by the scientific development of what is happening globally. We learned that there are also other factors which are needed, which probably we might have overlooked at the beginning, that it's best to keep the person in the home environment. Because you need also psychosocial support, because it had been more of an, of course we are saying isolation, but it was not meant also to isolate this person from the public. You need that psychosocial support, which could come also from the household members. So what we are encouraging this time is people to stay at home, but we need to try by all means to apply those measures. That's why we also in our guidance we are saying, for example, if it's a parent, you have children that cannot really stay away from you, maybe young ones or little ones, and you are to quarantine or to isolate. Of course, if you are isolating, immediately those are your contacts. They need also to stay at home in quarantine. But also if you are quarantining, but though we are not quarantining contacts of contacts, in case of the little ones who cannot really stay away from you, those ones are also advised that they remain like in quarantine together with you. However, for the isolation, we look at the condition of the person who is infected. If it's asymptomatic, of course, remain isolated at home. Mild cases, meaning that you have minor symptoms, also continue isolating at home. At this stage, as a Minister of Health, with partners, we have built capacity for admission. So we have adequate facility space in the hospitals to admit the infected people who are severely sick and those who are critical. And also those who are moderately sick, this moderation or the level I would not get into detail now because these are the one determined by the treating doctor. They will determine at which level are you based on your symptoms. Those who are severely sick or have severe sickness, definitely they need to be admitted, and they should be admitted in the hospitals. So by this stage, we believe we have adequate space in the hospital to provide for this group. Mainly the people with comorbidity whose condition can change unexpectedly, so that they are well monitored to avoid negative outcomes. So those are the ones we are targeting, that they should be admitted.
All right. We have a comment from social media. Please put it through. Mr. Philippus Iambo. Good afternoon, Madam. I would like to ask concerning about vaccinated, whether still by his or her wish. Okay, so Mr. Iambo would want to find out vaccinated is or wish. Okay, whether vaccination is still compulsory or not. Dr. Catherine, would you want to tend to that before we move on with the discussion?
Before I answer this question, I think I would like to appeal to the general public that vaccination is very, very important, and taking the vaccine, the COVID-19 vaccine, our data has shown from case management point of view that all our cases that are hospitalized, about 95% of those cases are unvaccinated, among the unvaccinated. And please do remember that the cases that are being hospitalized are those of severe and critical cases. So vaccination really protects against severe illness. Having said that, vaccination is not compulsory. However, it is recommended that we all get vaccinated if we really would like to have our normal lives back. If we have a sizable population that is vaccinated, say about 70% of our population is vaccinated, we will have herd immunity. And as I mentioned earlier, that even when you get infected after being vaccinated, the virus that is not potent enough to replicate and cause severe illness, critical, or even death. So it would be recommended that we all get vaccinated. However, vaccination is still your choice.
Perfect. So the under key word there, they are not yet compulsory, Mr. Iambo. Before the question, Ms. Ndevatela, you spoke about people quarantining at home, and government has completely stopped giving such services. I would then want to find out, how do you care with somebody? How do you take care of somebody at home that is not feeling well? In this case, Mama is quarantined or is isolating. How do I take care of her?
Okay, as I said, the people who are quarantining at home are the ones who are like the asymptomatics. You are infected, you're tested positive for COVID, but you don't have any issue. Maybe you were just tested because you were exposed to a contact. Then day 5, you went for a test, your test comes out positive. You remain at home, but you don't need much support from others. But of course, what we are cautioning is, let's observe some measures at home, like keeping your mask on. Try not to be too closer to others, that is still observing your physical distance, as we had been preaching. Try not to, also if you have to get visitors, when you have an infected person in the house, that is the time, at least if you can, for people who can call and say, no, I'm coming to visit you, then at least it's best to communicate that you should avoid visitors at that stage, because you don't want really more people to come into contact with that. For those who have mild symptoms, of course, these are also just, as we say, it's light symptoms, which they are not avoiding you to do your usual things. You can bath yourself, you can eat yourself, but for those who need to be supported, those are the ones who need now to be admitted because they cannot help themselves. And you know, the reason for admission is to be fully investigated for other possible complications, because you don't want negative outcome. That's why we want people to be treated early. So though COVID itself being a virus, we don't have a specific treatment, we treat symptomatically, and if any complication is picked up, then it's being addressed also timely. So those are the areas. So we don't want people to have their sick people at home because of COVID, because we are talking of home isolation. If the person cannot help himself or herself, it's best that person is taken to the hospital, evaluated by the medical team, then they would decide on the next course of action, which is most likely to be admitted if that person fit the criteria for admission. Otherwise, we are saying, of course, it might not be evitable that at one point a person might need support from the household member. If you are to provide if you are eating, for example, we have cultures where you share, you eat from the same utensil. So we should try by all means that the person who is sick should not share the eating utensils, and they should be cleaned properly after use. They should at least distance themselves. This is the normal physical distancing which we had been preaching, and they should be putting on their face mask, well-fitted face mask. And they should also, I know it's cold weather, but we still need well-ventilated environment. It's best to open our windows, because even it's cold, at least get that fresh air from inside to circulate inside the house or inside the room. So it's not good just to have closed environment, then there is no fresh air coming in. It's a good ventilation. So thank you.
Thank you, Mr. Vitala. So we have been observing a low number of people getting tested for COVID-19, but the positivity rate remains high. Does this, by any chance, indicate that we have a lot of undiagnosed cases out there? Dr. Catherine?
Thank you for that question. Actually, our positivity rate in the last week or so has gone down tremendously. And so this, coupled with the fact that we are not seeing very sick patients coming to health facilities, it may be an indication that actually we are on the downward trend with the virus. In other words, we are going down in the fifth wave. So I really think the positivity rate is continuing to go down. And also because of the fact that we are not seeing sick patients coming to health facilities, it may be an indication that actually the numbers are going down. However, we still need to remain vigilant and ensure that we observe the public health measures, and we also should endeavor to have or take the vaccine.
All right. Ms. Ndevitala, where can the public get the revised COVID-19 isolation and quarantine guidelines?
Okay, thank you very much. The ministry, after revising this guideline, of course, first it was to inform the health care providers. So these guidelines were given to the healthcare providers, both in public and private sectors. They were sent to all the regions, health regional directorates, with the message that they should be distributed to all health workers in both sectors. So if anybody might be in a private and you did not have access to this, you can reach out to your nearest regional office, district office, or any facility, at least to get a copy of this. For the public, we have also summarized this guidance, because we all need to know what is expected of us, because we need to take responsibility as well. So we have issued what we call a public notice, which was shared with all the media houses. And the aim to share this, at least, is for the media also to help the ministry and the government at large to share this public notice with the public. So probably which we did not do is to give it to the print media. Probably that is the next stage, which as a ministry we might need to do, so that it reach out. And for us being here today, it's also that one means of ensuring that this message reach out to the masses. So those are the measures which we are using. Thank you.
Well, Namibia, that was our discussion on the revised COVID-19 regulations on isolation and quarantine. We are basically urged to actually spread the news, and I would want to invite you, the Namibian viewers and listeners, our nation at large, to join us again on Wednesday as we discuss the basic conditions of employment in Namibia. Until then, goodbye, Namibia.